Hello guys, I'm Professor Jafar Zadepur from Nurai Hospital and I gonna to explain about medical ophthalmic lenses, a special line for ophthalmic lenses that could manage special eye disease and refractive situation that it's very complicated for designing and also for prescription. Actually, this discussion is about the myopia control lenses, and also from this uh, session, I'm gonna to explain more about the different method of controlling of myopia. However, the first question is what's the myopia? Myopia is a situation that when the patient see the very far objects such as this tree in the picture that you can see in the upper side of this picture, the parallel rays come from the tree to the eye. They are focused in front of the retina. It means that the patient cannot see clearly the tree. However, the books in near distance from the eye would be see very clearly. It means that the patient can see the object in near to the eye, but cannot see very far object. In the picture, in the left side, you can see the parallel rays that come to eye are focused on the retina in normal eye, but in myopic eye, they are focused in front of the retina. It means that the image in the myopic eye is very blur for the distance object. Uh, there are two main type of the myopia. The first one is curvature or refractive myopia. In the upper picture, you can see the cornea in the normal eye that it shows but dot lines, and in myopic cornea that is showed by red lines. It can see that in the myopic cornea, the curvature of the cornea is increased. It means that the cornea in the myopic eye is more steep, or the curvature is more than normal eye. It means that the power of the cornea increase and the refraction of the rays would be more in myopic patient. The other cause of the myopia is axial myopia. Axial myopia is a situation that the axial length of the eye increased, and therefore the focal lane of the focal point of the eye is in front of the retina. In both situations, the focus of the rays is not on the retina. What the cause of the myopia? There are two main cause of the myopia according to different study in these years shows that the genetics is one of most important factors that affect to the cause of the myopia. Uh, it is determined by the genetic situation of the father and mother and the transmit of the genes for the myopia to the kids, and therefore it's very important that we should examine the kids that both of their father and mother are suffering from the myopia in very early age, and myopia may be very soon happen in these children. However, the environmental factors such as the light, uh, indoor activity, digital device, and screen time are very important factors that may cause increase the myopia and cause the myopia in the children. Also, the level of education and accommodation and the light of the environment is very, very important for increasing the myopia. There are many theories for myopia. This picture is very, very important picture that I will use it in the next slide. However, uh, please remember this picture, and also I show it again. But there are different theory for the increasing the myopia. First theory is contrast theory. Contrast theory is a theory that explained that the myopia may increase due to lack of the contrast of the object. It means if the contrast the object that uh, people see decreased, the risk of the myopia would be increased significantly. And the second theory is for the rod and cone mechanism. There are two photoreceptors in the eyes. One is the rod cells that it usually used in the dim dark, and cone cells that are usually used in the very, very bright light. According to this theory, if we use more for the rod cells and less cone cells, the risk of the myopia would be increased. It means if we situate it and do the visual task in the dim light, the risk of the myopia would be increased prominently. And spatial and temporal contrast. Both situation for the contrast, spatial and the temporal, both of them can, if the contrast sensitivity in the spatial and temporal situation decreased, the risk of the myopia would be increased also. Adaptation, it means the situation that the environmental light decreased, the risk of the myopia would be increased also. The technology for the controlling of the myopia situated according to different type of the theory that I explained. There are different methods for management of the myopia according to different study and different approach for controlling of the myopia. There are different effectivity and also uh, management of the myopia in different approach. For instance, one of the methods for controlling of myopia is using the progressive ophthalmic lenses for the patient. This is a method is very easy and conventional method that use the progressive lenses for patient for the full time wearing the glasses. But this method effectivity is less than 30%. And also bifocal lenses, I mean the ophthalmic lenses in bifocal situation is another method that the effectivity of this method is not very high. Multifocal contact lenses in different design also are very good and effective approach. The effectivity of the multifocal contact lens is about 50%. And orthokeratology lenses is a new and modern method for controlling of myopia, especially in teenager, is a very, very good and effective technique. And the effectivity of the controlling of myopia and management of the controlling the increase of the axial length of the eye is about up to 65%. Low-dose atropine is another method for management of the myopia for the kids, and it's very effective. But use of the different medication to the eye may have some side effects. And also for the long term of use of the medication, it has many controversy for the patient. Actually, continuous use of the low dose atropine is very difficult for many patients. And finally, the most common method for controlling of the myopia is ophthalmic lens with special design that uh, in different company have different name, and I will explain more about in the next slide. Progressive lenses is a very well-known method for the correction of the refractive error. Actually, for the kids, usually used for the strabismus, but for controlling a myopia, uh, it is not very long-term use of the progressive lenses. Actually, the complication and also complicated situation when we use the progressive lenses for the kids is that when you use these small frames with a small eye size, that it should contain the far, intermediate, and near vision reading. And also, the design of lens is very, very important. Sometimes some companies use the adult design for the kids. For this situation, the lens is not very effective because the situation of the eyesight, sight line, and the measure reference point for the lenses and optical center of the lenses are not coincident with each other, and therefore, when the patient see through the lens, the situation of the eye for the far vision, intermediate, and near vision is not very good, and patient may suffer from some symptoms of distortion and blurry eyes, and also discontinue using the lenses. Actually, this kind of lens are not very cheap. They are very expensive, and usually is not affordable for some patient to wear the this kind of the glasses. Actually, the effectivity of the progressive lenses is not very high. However, for the patient that the other type of the method is not available for them, the progressive lenses may be only remaining method for controlling of the myopia. Bifocal spectacle lenses is another method that usually in the kids the segment of the bifocal lenses is should be very very big because the dynamic range of the eye movement in the kids is very very extended, and the kids are very very active, and therefore they need very big and long uh, near vision. However, the kids are not very stable for the glasses because they are very active, and measurement of the near vision for these kids are very crucial and very important because in different viewing situation and different situation the bifocal lenses may not properly used. However, the glasses stability is another issue that should be considered for the patient. Contact lens is another method for controlling of myopia. Different design of the contact lenses for concentric design and aspheric design are two most common methods for the controlling of the myopia and also for correction of the presbyopia. The previous generation of the contact lens, multifocal contact lens, was concentric design of the contact lenses. In this design, the near and far rings concentrically located to each other. Therefore, at the same time, the far and near image would be clearly focused on the retina. However, the patient should choose between the near and far vision, but the image quality is not very good because the image is very discrete according to location of the rings. Icebrick design is a new design for the multifocal contact lenses that gradually the power of the lens change from the center to the periphery of the lens, and it has two different design, D lens and N lens. D lens are some kind of lens that the center part of the lens dedicated to the far vision or distance vision, and gradually the intermediate part of the lens is used for the intermediate vision, and the for far vision, the periphery of the lens, and is used for the periphery of the for the near vision actually. This kind of design is very good for the controlling of myopia. However, the different design of N lenses, that the center part of the lens is for near vision, the intermediate part for intermediate vision, and periphery part is for the far vision, is usable for just presbyopia. However, using the contact lens may have some difficulty for the precipitation, the infection, and other problem that may usually happen due to improper handling, using, and aftercare of the contact lenses. Uh, Actually, another issue for the contact lenses is that the proper fitting of the contact lenses. It means the power of the contact lenses should be selected in a manner that the uh, proper position of the far vision, near vision, and intermediate vision is selected according to pupil size. If the pupil size is not uh, properly in the light and dark situation, patient may lose some vision, for instance, near or far or intermediate due to pupil size. Actually, for some patient, the use of the contact lens may be very critical due to the improper disinfection of the lens and use of the contact lenses. Therefore, another design of the contact lenses developed in these years, it is orthokeratology contact lenses. This kind of lenses have two types. One type for myopia control with different design. You can see this kind of design of the orthokeratology lenses for myopia control. As you see this kind of lens, at the center part of the lens is very flat, and it touches the center part of the cornea. This attachment to the center part of the cornea caused the center part of the cornea gradually became flat, and intermediate part is a little bit steep, and it has a chance to be a little bit more steep, and the periphery of the lenses is a gradual changing in steep and flat situation. In this design, we can change the shape of the cornea in a manner that its power and refractive power change in a manner that can focus the peripheral focus of the peripheral plane of the focal plane of the image that is behind the retina, and it can be focused on the retina, and this situation would decrease the risk of the myopia improvement. This kind of the orthokeratology lenses usually wear uh, at night. It means that the patient use the contact lenses and go to sleep, and when he wake up, remove the lenses, and during the day don't use the lenses, without the lenses. And this situation gradually would be happen about 14 days take place to completely change the corneal shape. It is the schematic shape of the changing the cornea, and finally, as you can see in topographic image at the bottom of the this slide, the center part of the cornea would be flat and cornea would be have the different shape, and this situation would change the focal plane of the eyes, and therefore the risk of the myopia would be decreased. However, the price of this kind of lens is very high, and also prescription of this kind of lens needs many instruments, and very educated optometrists should know the uh, method of the prescribing this kind of lens. And in many countries and many places, this kind of lenses may not be available. Another method for controlling of myopia is using the low-dose atropine. Atropine is a very, very well-known uh, medication. The history of atropine is very, very long, but low-dose atropine, I mean the concentration of the 0.01 or 0.05, is the very common for controlling of myopia. The patient should use all the night before the sleeping this kind of the medication, and it shows that it may be very effective, but there are many controversy about the uh, situation of the effectivity, side effect, and mechanism of the low dose atropine. However, the main topic of our discussion is about ophthalmic lenses. Ophthalmic lenses that are very important devices for controlling of myopia, because the patient use the glasses. The glasses is very, very safe method for correcting the myopia, and also it's very conventional, and many people believe that it's very safe, because when a problem happen with the glasses, we can change just glasses. There is no risk for the contact lens, there is no risk for the medication and any other method. One of the very famous type of the uh, myopia control ophthalmic lenses is DIMS lenses. They focus incorporated multiple segment that is developed by Hoya company. Uh, it has small dots that the size of this dot, the focus dot, is about 1.03 millimeter. Uh, in a specific place, the center part of the lens is completely clear, about 9 millimeter. It means the patient see through the center part of the lens, the center part of the image at the fova or the macula is completely focused, and the peripheral part that uh, the problem for developing is causing the developing the myopia, it's defocused by this lenslet and these segments. According to this, according to different study that is done for this kind of the lens, the effectivity of the DIMS lenses is about 59%. However, this type of study is not very intensive and very extended study. Most of them are for this kind of lenses are case series or cross-sectional study. Another type of the myopia control lenses are STLS lenses. The STLS lenses is developed by Essilor company, and many Chinese design also obey from this design. The center part of the lens is about 5 millimeter, and the concentric ring around this clear area consists of small circles with small diameter of 1.1 millimeter. The distance between the center of this circle is about 2.3 millimeters, and 11 rings consist in the lenses. And the effectivity of this kind of lens is very high, is about 67%, but there is no very clinical trial for this kind of the lenses. Most of them are very limited and cross-sectional study. Another type of design for myopia control lenses are dot design, diffusion optic technology that is developed by sight glass vision. The center part is about 5 millimeters, and the periphery of the lens are located small dots that defocus the periphery of vision and can manage the myopia about 36% in patients. Zeiss company developed the Care and Care S lenses. Uh, this type of lens are that the center of the lens is about 7 or 9 millimeter clear vision, and the periphery part is the cylindrical concentric rings that the diameter of the width of each ring is about 0.5 millimeter, and distance between each cylinder is about zero point 0.5 millimeter. It causes a discrete and discontinuous image of the periphery, and the distortion of the lens is a little bit high. For this reason, for all the lenses that I mentioned up to now, they are discrete or discontinuous image for the periphery, and the distortion is the main problem for this type of the discontinuous lenses. However, the study shows that the effectivity of the Zeiss lenses is about 36%. Uh, IoT company developed a design that is Myo-less lenses. It is for the customized and RX lenses. It's an asymmetric continuous design for changing the power of the lens from the center to periphery. The asymmetric of the design may improve the effectivity of the myopia control because when we look at the near object, the image on the retina and the amount of the light on the retina in the up and down part of the retina is not the same, and the image also is not the same. According to different study, it shows that the asymmetry of the image may improve the effectivity of the control of the myopia. However, the effectivity of the IoT design is not very high. It's about 39% for this kind of lens. Actually, as I told you, it is according to limited and cross-sectional study for this type of lens. And the final design that is according to concept of the myopia control, according to contact lenses, according to the different type of the lenses that I mentioned to you, but in the continuous way is the myostop design. It is a customized design for myopia control lenses. It means that changing the power from the center to the periphery is according to specific algorithm for changing the power and also changing the defocus, cylindrical defocus for different part of the lenses. The technology is based on ray tracing. It means that each part of the lens is calculated independently to other part, and the tracing the ray for each part of the lenses is done according to this design. This situation may improve the quality of the peripheral part of the image, that is a complication for the other design of the myopia control lenses, because as I told you, the peripheral part of the lenses for different type of the design was discrete. It means that this discontinuity of the design caused the diffraction. But this continuous uh, changing the power for the myo stop lenses make very smooth and very comfortable situation for the uh, peripheral part of the image, and also it can defocus and it can affect the defocus part of the retina and can be very very effective to focus the image on the retina at the peripheral part. However, you can compare the image that is seen by conventional myopia control lenses and myostop lenses. It is clear the all part of the lens is very clear and comfortable for the kids, and for the conventional myopia control lenses, the peripheral part is a little bit blurred. Another advantage of the Mayo stop design is the geometrical advantage of this design. Uh, According to the algorithm used for ray tracing, it is possible that Mayo stop lenses be more smooth and thinner and very very compact in comparison to other design of the lenses. It means that not only patient uh, can be very happy with the clear vision, but also he can be very happy due to very thin and light weight of the lens in the glasses. Uh, According to different study, it shows that the myopia control lenses, I mean myostop lenses, that is developed by Optoplus and it is developed by Adel Optic lenses. It is very acceptable, and about up to 36% can effectively control the myopia for the kids and children. This concept is actually according to, as I told you, the multifocal aspheric continuous contact lenses that's very effective for controlling of myopia. However, as you can see over here at the center part of the lens, the power is, for instance, minus 3 and without any cylinder. And for the peripheral part or intermediate part, the power, as you can see over here, it gradually decrease. It means minus 2 or 63. It means it's a little bit less, but a little cylindrical added to it. It means that the peripheral defocus would be more focused on the retina in this situation. There is a study that is prospective randomized controlled double mask trial to assess the performance of the myostop lenses in slowing myopia progression in children. Actually, this study uh, it was done with another company, but the same design. The name of the lens, according to this design, is MyoSlow. In this study, about 149 kids was selected. They are separated to two groups, one in the conventional lens and another group in the uh, group for the myostop lenses. Uh, Interestingly, most of the patient wear the glasses very comfortable. They find out it's very comfortable and very useful in comparison to other type of the lenses that about 76% of the patient accept to wearing the traditional lenses. It means that this type of lens is more acceptable for the children. After 12 months of using this kind of the lenses, 36 efficiency was observed in the age of 6 up to 9 groups compared to traditional lenses. It means the myopia can be managed uh, in this group, the power of the myopia about 60%. Uh, for example, if the child initially had the minus 3 diopter of myopia at the start of the study, after 12 months wearing this kind of the lens, myostop or myoslow, doesn't make any difference. The progression was 0.56 diopter, and in traditional type of lens, the progression was 0.87 diopter. Uh, In other words, myostop or myoslow lenses reduce the myopia progression by 0.31 diopter, that it corresponds to efficacy of the 36%. In this slide, we can see that the effectivity of the this kind of lens is more in females. uh, it means the girl between age of 6 up to 9 are very good choice for this kind of lens, especially when they one of their parents use the glasses and they are myopic also. Another important thing for myostop or myoslow lenses is that it causes to prevent from the elongation of the eye. As I told you, one of the reasons for increasing the myopia is elongation of the eye. It means that increasing the eye size or the dimension of the eye or axial length of the eye, it causes improving the myopia. It can prevent the elongation of the eye up to 32%. It means that after 12 months of using this kind of the lens, not only the myopia is managed, but also the axial length is controlled significantly. Uh, it shows the same result that I explained for you. It means that the effectivity and variability acceptance of the lens is very good for the stop lenses, and it's very beneficial for the kids from the age of 6 to 9. And finally, myoslow or myostop lenses, very effective to traditional lenses, and also it should be started as soon as possible that we come across the patient or kids or children suffer from the myopia. It's very important. However, combination of the myopia control lenses, ophthalmic lenses, with some other modalities such as atropine, low dose atropine, it may be more effective. According to different new study, it shows that the synergist action of the low dose atropine with myopia control ophthalmic lenses is very prominent, and we suggest you that use the ophthalmic myopia control lenses with some dose of the atropine, low dose atropine. Thank you very much your attention. I hope that this presentation would be very beneficial for you, and please send me your suggestion and your comment about this presentation to my email, and I hope to have another presentation very soon with you. Thank you.